So, hello friends. So, acidity is very common symptom amongst people. Most of patients are coming with they are taking a lot of self medication that is containing omeprazole and all these things. So, what are the common causes of acidity? So, see, acid forms in our stomach, and which is really necessary to in order to digest the food that we had taken, and also it also has antimicrobial property because we have take a lot of foods and which contains a lot of microorganisms. So in that protective way also kill the microorganism as well. So sometimes whatever we take, it goes down to the esophagus, that is a tube that is connecting between stomach and our mouth. And in the lower part where this tube esophagus is joining to stomach, there has been one sphincter and which not allow that matter that we have eaten, which is not a reflux into the esophagus, a reflux back into the esophagus. Due to some disturbances or the lack of tone in that lower sphincter, the food matter that we have taken is get back into the esophagus, and due to this, which now really contained hydrochloric acid, whenever it comes to the esophagus, it start so much burning and irritation. So we have feels that just discomfort and burning even up to the mouth as well. So these are the phenomenon that is happening in the acidity. So there has been number of other factors also that contributes the acidity. One is obesity. If you are obese person and there has been a lot of belly fat is there, abdominal fat is there, so this fat is compressing your stomach, and due to this compression the food gets reflux in the esophagus. The next important early morning, or we call it as a bed tea. So we a lot of people, they are taking tea with in an early bed. So what happens, there has been already hydrochloric acid has been formed over the night, and you are taking already such a stimulant drink, and which is also getting contributing to form and make and bigger number of these acidic environment in the stomach, which is also we have to think of. Then there has been some spicy and foods that is also contributing to your acidity. There has been alcohol, which is those patients who are heavy drinkers. In this patient also we will see that they have been this sufferer of acidity. So we have to take care of all the food that we are taking, and we have to also uh, make sure that which are the food that which is aggravating our factor. So the treatment parts will depend upon what aggravating factor that is contributing to your acidity. So another important thing is that treatment. So a lot of patients that we often see that they are taking self-medication, that they are taking omeprazole, all these anti what we call acidity medicines. So which can easily replaceable by homeopathic medicines like Nux vomica, which is itself going to cure a number of 70 to 80% of acidity cases. So you can take as a replacement of omeprazole, you can take Nux vomica. Uh, some people are having a severe headache during their acidity time. So at that particular time, you take iris versicolor. This is also very helpful medicine that you can think of. Another medicine is carboveg. When there has been a lot of gas, that a lot of bloating is there in abdomen, flatulence is there, then you can think of carboveg. So all this medicine, particularly if you have complaint of acidity, then you plainly only you can take Nux vomica. Don't uh, try all these medicines. Try one by one. If you get better by any medicine, you can continue with it. If it is not getting better, then you have to consult a proper physician, and that physician will decide which medicine is suitable for you. Or there is an other number of medicines in homeopathy which is going to cure your acidity. So it's just an primary aid, first aid that you can use this medicine. Okay. So I hope this video is helpful for you. So thank you so much.